Right. We are continuing our circulatory system, but this time we are looking at blood clotting. Blood clotting. And the medical term for blood clotting is haemostasis. Haemostasis. Hem means blood, and stasis means to control. So, haemostasis. Anytime there is blood clot, it means that there is something wrong with the inner lining of the blood vessel. So looking at this diagram, you can see that there is a cut. Okay, once there is a cut in the blood vessels, the place becomes rough. So the blood platelets begin to come together. They become sticky and then they come together so that they will form the clot. All right? Okay, so as our learning objectives, we are going to describe the mechanisms of hemostasis. Hemostasis is different from homeostasis. Hemostasis is maintenance of blood flow, and homeostasis is maintenance of a constant internal environment. And then we will try and discuss some blood diseases. And the key words, we have fibrin, thrombin, and von Willebrand factor. They are all parts that make the blood clot or help the blood clot so that we don't lose too much blood. Now, once there is a cut in a blood vessel or on a blood vessel, the first thing is that the blood vessels will constrict, and we call that vasoconstriction. We call that vasoconstriction. And the platelets will form a plug. The platelets come together to form a plug, and blood coagulation begins. And when the blood clot forms, if it's on the surface, on the outer surface, and the blood clot forms, it will protect the body from microorganisms that try to enter the wound. So when the blood clot forms, it's actually preventing loss of blood from the blood vessel and also protecting it from the outside environment. And then it will retract, it pull the ends of the wound, and then it will form a scab. When the wound heals below the scab, then the scab is not necessary, it just falls off. And if it should happen inside the body, then it will go through fibrinolysis, where the blood clot is dissolved. So, that is it. Hemostasis. Hemo is blood and stay means to remain. And is the stoppage of bleeding. Is the stoppage of bleeding, which is of vital importance when blood vessels are damaged. Following an injury to blood vessels, several actions may help to prevent blood loss, including vessels that constrict or vasoconstriction, platelet formation, blood clotting, and formation of a clot. So the first thing when there is bleeding is that the blood vessel will constrict. That is vasoconstriction. And it's actually due to the sympathetic reflex actions and also due to local spasms of blood, of the smooth muscles of the blood vessels. And that can be maintained by platelets and vasoconstrictors. By platelets and vasoconstrictors. Now, we have various factors that bring about clotting. Fibrinogen is one, calcium is one, von Willebrand factor is one, tissue factor, prothrombin, Christmas factor, Stewart factor, all these. We have 13 factors, but they don't follow one after the other. They don't follow one after the other. So the first thing that happens is that an enzyme called thrombin, must be converted from prothrombin into thrombin, and that will convert fibrinogen into fibrin. Fibrinogen is a soluble blood protein found in the plasma, but when it becomes fibrin, fibrin is insoluble. And fibrin acts as a mesh so that it will trap the blood cells from escaping out of the blood vessel. Now, the coagulation mechanism is composed of two pathways. We have the extrinsic pathway, we have the intrinsic pathway, which eventually merge to form one pathway. The intrinsic pathway takes longer than the extrinsic pathway. And with the help of calcium, it brings about the clotting. When blood comes in contact with injured tissues, the tissue thromboplastin, which is factor 3, interacts with proconvertin and calcium, activating the steward factors so that it brings about the clotting. All right? So, the intrinsic pathway and the extrinsic pathway is what bring about the common pathway so that the clotting will occur. Now, they all occur as a result of the extrinsic, intrinsic coming together to form the common pathway with the help of the prothrombin activator, so that prothrombin is converted into thrombin in the presence of calcium ions, so that it will form the clot. The common pathway is activated by tissue factor 10 in the presence of calcium. So what I want you to remember is calcium, thrombin, and the intrinsic and then the extrinsic pathways. The factors are many, but if you remember calcium, prothrombin, and then the intrinsic and the extrinsic pathway, you are looking at the process of the blood clotting. Right. So when fibrinogen is converted into fibrin, you are looking at the enzyme thrombin present, and the thrombin will cause the fibrinogen to turn into becoming fibrin. Fibrin is insoluble, and the fibrin stabilizing factor is stabilized to become fibrin in the presence of calcium 2+ ions. And the process takes place. Now, if the clot is within the body, then we have something called fibrinolysis. And fibrinolysis, you are looking at the process where the blood that has clotted is now dissolved. In this case, you are looking at plasmin. Plasmin, it is formed from plasminogen, and the enzyme activator is the enzymes from urine, from tears, from saliva. We have the enzyme called streptokinase. And plasmin as an enzyme is involved in breaking down fibrin into soluble fragments, and the process is known as fibrinolysis. Plasminogen is converted by its activators to become plasmin, and the plasmin converts the fibrin into soluble fragments. Okay, so dissolving blood clots, we have plasmin, which is coming from plasminogen. Plasminogen is converted into plasmin, and the plasmin dissolves the fibrin into soluble fragments, Now, dissolving blood clot is a positive feedback mechanism. Dissolving blood clot is a positive feedback mechanism, as you can see on the board. Dissolving it. So the plasminogen is converted into plasmin, and then the plasmin dissolves the fibrin, and then the clot is dissolved while it is inside. But on the outside, it's not the same. On the outside, it's not the same. So this is how a blood clot looks like. This is how the blood clot looks like. And there are anticoagulants in the body. The body has its own method of dissolving clots if there are clots in the blood. And so although tissues break down and platelets distractions are normal events in the absence of trauma, intravascular clotting does not usually occur because there are various amounts of procoagulants released in very small quantities, so that the natural anticoagulants are present. So if there are blood clots in the blood, the natural anticoagulants will dissolve it. One of them is antithrombin 3. Antithrombin 3. Heparin, also in the blood. Antithromboplastin, protein C and S, and fibrin fibers. They all are anticoagulants, the body's own way of dissolving clots, if clots form. When the blood is too thick, it will begin to form clots. So the body's own natural way of dissolving the clots is with the help of heparin produced by the blood in the body. Antithrombin, antithromboplastin, they dissolve the clots. So the antithrombin inhibits factor 10 and thrombin. Heparin from basophils and mast cells potentiates effects of antithrombin 3, so that together they inhibit the factors and thrombin. Once thrombin is formed, it means that clotting will occur in the blood. Once thrombin is formed, it means that clotting will occur with the help of calcium. So if there are factors that inhibit thrombin from forming, it means that blood clotting is maintained or controlled. Okay? Now, there are sometimes abnormalities in clotting, in blood clotting. So here we are looking at the normal bleeding. And once bleeding starts, the blood vessel will constrict, leading to vasoconstriction. So you can see here that the blood vessel has constricted, and then platelets will come to form the platelet plug, and that will lead to fibrin clots. Okay? Now, if bleeding starts and there isn't enough platelet plug, there will still be bleeding occurring. Okay? If there isn't enough platelets in the blood, it will lead to blood still being lost or blood flowing out of the vessel. Now, one of the conditions where there is very little platelets is thrombocytopenia. Thrombocytopenia. And this causes spontaneous bleeding as a reaction to minor trauma. In the skin, you have reddish, purple, blotchy rash. It may result in decreased production, toxins, radiations, infections, leukemias, increased distraction of autoimmune processes, increased platelets consumptions. So one of the causes where there is very little platelets and there is injury to the blood vessel, you are looking at thrombocytopenia. Another example of thrombocytopenia is what you see up on the board. So there is a lot of blood that has been released from blood vessels onto the skin surface, okay, and it can be deadly. It can be deadly. Another one is hepatic failure. Hepatic failure. The reason why is that most of the clotting factors are formed by the liver. So if there is very little or no clotting factors, then it can lead to the eye, instead of having the sclera being white, it becomes red because of bleeding into the sclera. Subconjunctival hemorrhaging. Subconjunctival hemorrhaging. Right. The next one we are looking at is disseminated intravascular coagulation. There is a widespread coagulation or thrombosis in small blood vessels, and this leads to increase in fibrinolysis and depletion of coagulating factors, and this is generalized as bleeding. It may result in bacterial infections, disseminated cancers, complicated in pregnancies, severe catabolic states. So here we also have hemophilia, lack of factor 8, and hemophilia A and hemophilia B. Hemophilia A is as a result of lack of factor 8, and B is lack of factor 9. And they are all genetic, transmitted genetically. And it affects only the male children. The females are carriers. Okay? They don't show the symptoms, but they carry the gene. And the males are the ones that suffer from it. Hemophilia A is spontaneous or traumatic subcutaneous bleeding. Bleeding under the skin, blood in the urine, bleeding in the mouth, in the lips, on the lips, and then on the tongue, bleeding at the joints, the central nervous system, and then the gastrointestinal tract with hemophilia A. Okay? Right. The Russian Tsar Alexei Romanov suffered from hemophilia A. He suffered from hemophilia A. Now, there is a test of coagulation. Test of coagulation. You have both the intrinsic and then the extrinsic factors coming together with the help of calcium, and the extrinsic factor is faster than the intrinsic. If you look up on the board, you see that the intrinsic factor takes between 25 and 35 seconds. Extrinsic factor takes between 9.9 seconds and 13 seconds. And the prothrombin time is the test that evaluates extrinsic system. And the normal time is between 11 and 15 seconds. 11 and 15 seconds. In the presence of calcium and the other factors plus thrombin, then you are looking at the clot. You are looking at the blood clot. International normalized ratio, that is the prothrombin time and intrinsic and extrinsic factors. We can have the application of monitoring the oral coagulation therapy. Example, using warfarin for the person who has a problem with clotting. So if somebody has a problem with clotting, the person is put on blood thinners for the rest of the person's life. The reason why is that If the clot gets into the brain, it can cause stroke. If the clot gets into the heart, it can cause heart attack. If it gets into the lungs, it can cause the lungs to stop functioning, and it can lead, all three of them can lead to death. So at any time, they have mechanisms for dissolving the clots with these medications, warfarin, heparin, and others. Even aspirin can cause the blood to become thinner. So prothrombin time, the normal time is between 14 and 15 seconds. Heparin, which is much more sensitive than the prothrombin time. We have hypofibrinogenemia. That means that the person has a lower fibrin clotting time. Now, there are several causes that lead to blood clotting. We have factor deficiency, antibody to clotting factors, heparin, excessive warfarin, and so on and so forth. Now, the bleeding times are all different for these conditions, so that if you have the prothrombin time, then you are looking at factor 10, factor 5, factor 2, factor 7, or all of them fibrinogen deficiencies. And antibodies, warfarin, vitamin K, excessive heparin, all of them come in. Bleeding time, you have thrombocytopenia, von Willebrand disease, drugs like aspirin, NSAIDs, high-dose penicillins, cirrhosis, and so on and so forth. Okay, they are all leading to they will all lead to abnormal coagulation tests. Abnormal coagulation test. Okay, so the time taken for blood to clot mainly reflect the time required for the generation of thrombin. The surface of the glass tube initiates the clotting process. This test is sensitive to the factors involved in the intrinsic pathway, and the expected range is from 4 to 10 minutes. 4 to 10 minutes when blood is taken from outside and put on a glass. The expected time for it to clot is between 4 and 10 minutes. Whole blood clotting time procedure. You need to clean the tips of the fingers with alcohol. Prick the finger tip with an automatic lancet and note the time when the blood first appears on the skin, and then touch the tube to the drop of blood. Break gently 1 centimeter of the tube at the end of 2 minutes, and every 30 seconds after that. And when the fibrin is formed, is between the 2 broken pieces of tube and the coagulation or clotting time is noted. Now, this is important when it comes to certain procedures. For instance, piercing, body piercings. A lot of people have more than one piercing, especially the females. Okay? And so the bleeding time is the time that is used to measure the speed at which small blood vessels close off, and the condition of the blood vessels and platelet function. This test is useful in detecting bleeding tendencies. The bleeding stops within 1 to 9 minutes. This may vary from lab to lab or how the test is measured. You can use the ear lobe to measure the time that it takes for the blood to clot. So that is what we just described for the bleeding time and the piercings of the ear lobe. Now, abnormal bleeding time. Prolonged bleeding time may indicate vascular defect or a blood vessel defect, a platelet function defect, or platelet count defect. Drugs that may increase this include dextran, indomethacin, and salicylates like aspirin. They thin the blood. Aspirin thins the blood. So that is why it's not going to cause the blood to clot quicker. It's not going to cause the blood to clot quicker. The new model for hemostasis. The new model for hemostasis, we have looking at 3 ways of it happening. And the first stage is called the initiation stage. The injury of vessel wall leads to contact between blood vessel and the subendothelial cells. When there is injury, the tissue factor is exposed and binds to factor 7 and 7A and factor 7, which is subsequently converted to factor 7A. And the complex between the tissue factor and factor 7A activates factor 9 and 10. And the factor 10A binds to factor 5A on the cell surface. Once there is an injury or a cut, the tissues become exposed. And so that brings about the initiation phase. And once the initiation phase is completed, it leads to the amplification. Amplification is where more platelets are sensitized to come to the place where there is injury. Okay? It converts small amount of prothrombin into thrombin, and small amounts of the thrombin generated activates the platelets locally, so that more platelets will come to the place, so that they stick together, okay, to form the plug. But the plug itself is not strong enough. If there is large flow of blood, it can wash the plug away. So that is why the third stage, called the propagation phase. The propagation phase is where the thrombin will cause fibrinogen to change to become fibrin. And in this case, a lot of thrombin will come together and then lead to the formation of the fibrin, which stabilizes the clot. The fibrin, which stabilizes the clot. So the initiation, the propagation, and the initiation, the amplification, and then the propagation stages where the blood clot will form. The blood clot will form. So in summary of what we've been able to do, hemostasis starts with the interaction between tissue factors and factor 7A on the surface of the damaged blood vessel. On the surface of the damaged blood vessel. The small amount of thrombin generated during the amplification phase activate platelets locally on whose surface the subsequent reactions take place. The resulting thrombin burst results in the formation of a stable clot. So we've seen this in the past. We've seen this diagram. So the conclusion is that in high doses of factor 7A, there is a binding to the surface of the locally activated platelets, where it leads to the formation of the thrombin burst. So if we want to prevent the thrombin burst, that means that we have to take medication that will stop the amplification stage, where there are a lot of platelets that come together to form the plug. Okay? That come to form the plug. Now let's study this condition to see what we have been able to learn if we can bring about some references, or if we can think of solutions to this man. A 35-year-old man complains of chronic physical fatigue, which began 3 to 4 years ago. He said he felt tired all the time, even though his occupation as a software developer was mentally but not physically demanding. He breathed comfortably at rest, but when he exerted himself, he experienced difficulty in breathing and had a hard time catching his breath. He also complained of more than usual mental fatigue, confessing an increasing inability to concentrate and focus his attention on tasks at hand. Colleagues noticed his pallor and his inattentiveness at brainstorming sessions and suggested he rescheduled his annual physical examinations for an earlier date. He complained of vague abdominal pain and sense of abdominal fullness. His appetite was depressed, and he thought perhaps his physical and mental symptoms were caused by poor diet. However, attempts to increase eating resulted in nausea. His stools, he said, were sometimes loose and tarry. Eventually, increased heart palpitations and chest pain made him seek medical advice. So when he went into the hospital, he was made to go for laboratory, and the findings showed that he had red blood cell that had gone down. He had hemoglobin levels that had gone down. He had mean corpuscular hemoglobin concentration that had gone down. He had mean corpuscular hemoglobin that had also gone down, and mean corpuscular volume that had gone down. So what can you say? What is the general medical condition that is being presented by this man? What fundamental change in function of blood related to the red blood cell? And what specific diagnosis is supported by the laboratory findings? And how could the stool be related to the findings? And the first thing is that he has anemia, because the level of blood had gone down. The level of hemoglobin had gone down. His red blood cell count had gone down. There is a reduction in oxygen carrying capacity of the blood, and thus a reduction in the delivery of oxygen to various body tissues. There is iron deficiency anemia. Most cases of iron deficiency anemia result from internal blood loss. The dark and tarry stools suggested that he had bleeding in the gastrointestinal tract, so that he had to go through further tests to determine the exact cause. Thank you very much for joining me